So I was assigned the topic, is there a problem with undertreatment of aortic stenosis? Let's see if we can get this. My disclosures, I'm involved in a number of the trials. I don't think it really is going to involve what I do here. So a couple of questions we need to answer in this talk. One is, what's the incidence and prevalence of symptomatic aortic stenosis in patients over 65? And I'm going to stick with slightly older patients right now. I'm not going to look at the entire population because it's really kind of what involves those of us that are doing TAVR. We want to know, is it underdiagnosed, and what this might mean for surgical valve replacements in the future and TAVR volumes in the future. So the incidence is how many people per year newly acquire the disease. The prevalence is how many people have had this disease during this time period that we're looking at. Now this is from the Mayo Clinic. This is looking at the prevalence of valve disease, both in the general population and those in Olmsted County where the Mayo Clinic is located. And you can see that as you get older, your risk of aortic valve disease and mitral valve disease go up. Mitral valve disease is actually more common than aortic valve disease. The aortic valve disease gets treated more commonly. And if we look at how often it occurs with people that are 65 to 74, it's about 1.4% have severe aortic stenosis, and over 75, it's about 4.6%. So if you kind of blend these together and you say that in 2016, there were probably about 49 million people that are over 65 years of age. If we say at 2%, that's about 490,000 cases of severe aortic stenosis. Now, one of the problems we see is that our population pyramids used to look like a pyramid. It would start with young people, and they would actually taper down to about 20, and then it would stabilize a little bit, and then they would start surviving for a while because all the young people died of strange things or trauma or things that young people do, and then it tapered over time. Now we're getting a column. People just aren't dying, and people are getting older and older and older. So people have looked at this, and there's a really good paper that came out of Peter Capitan and Nick Van Meegen's group at Erasmus, looking at the annual number of candidates for transcatheter aortic valve implantation per country in Europe, but it's going to be fairly similar to here. And so what they did is they started with the general population over 75 years of age. They looked at, in Europe, an estimate of how many people would have severe aortic stenosis, which would be about 3.4% of those. They looked at those that were symptomatic versus asymptomatic, and they're about 3/4 symptomatic and 1/4 asymptomatic. Asymptomatic, no TAVR. If you're symptomatic, some of these were going to get surgery, about 40% in Europe at that time, and about 60% were going to get, 40% were getting TAVR, 60% were getting surgery. And if you're going to get treated with TAVR, some of these were only medical managements because they're cohort C, and they could kind of taper down at each way, which how many people would likely be needing a TAVR. And they would estimate the TAVR per year for the US using this and for Europe. And based on adding intermediate risk, which we have added now, there should be about 51,999 TAVRs a year done in the US. If we add low risk, assuming the two low risk trials, which I expect to both be presented next year, are going to be positive trials, which I think is very, very likely, that gets us up to about 80,000 that need to be treated. So this was the STS ACC TVT registry as of 2017, 47,779 TAVRs. So we now had more TAVRs than aortic valves. Aortic valves are going down a little bit. It's clearly not a zero-sum game. But if we added intermediate risk, it would move it up to this. If we added low risk, it would move it up to that. So you can see that the number of TAVRs that we're likely to be doing are going to be really increasing. I didn't change the surgical numbers because I didn't really have a way to do that. They're probably going to continue to dip, but they're not going to go completely away. Now, if we look at the people out there, this was quoted to you earlier, this was Vinod Thirani's paper, looking at the STS and looking at where people sat. If high risk was defined as an STS over 8, that was about 6%. Intermediate 4 to 8, that was about 14%. And low risk was about 80%. Now, Adam and I were talking, these numbers probably don't, STS numbers don't probably really correlate with which is high, intermediate, and low anymore, because the STS changes every year. It's probably actually lower numbers than that. If you look at Denmark and how people are treated in Denmark by risk level, 100% of the high-risk people get TAVR. About 68% of the low-risk people are getting TAVR, and about 9 or 10% of the low-risk get TAVR. So if you look at underdiagnosis, this was a study that was done in England. They looked at 2,500 people that were over 65 years of age. They were seeing a primary care doctor. They had no diagnosis of valve disease. They got echoes on these people, and valve disease that was undetected previously was found in 51% of the respondents. 34% were these were just aortic sclerosis, 22% were mitral regurgitation, 15% were aortic regurgitation, But aortic stenosis at a significant level was presented at 1.3% in completely previously undiagnosed populations. And what you found is as you moved into the kind of lower social and economic portions of the patient population had less access to health care, and the number of new valve diseases were increased. So they could estimate in the UK what was going to happen with the diagnosis of aortic stenosis. The diagnosis of aortic stenosis was going to go up over time because the population was getting older, but the underdiagnosis was significant. It was at least 100% underdiagnosed in the UK. There's very little reason to assume the UK is going to be different than the US. In fact, this has been estimated at the US, looking at on the left what is the current prevalence, about 300,000 a year, as to what we really think it probably is, which is about 650,000 per year. Now, I remember when we started the high-risk and extreme-risk core valve trial, I was talking to my interventionist colleague, Neil Kleiman, and Neil said, well, we won't get any extreme risk. And I said, why, Neil? He said, because everybody I see, I send to you to operate on. And then we started extremists, and all these people came in, and Neil looked up and said, where are all these people coming from? I said, Neil, they never sent them to you because they didn't want you to send them to me for surgery. They're out there. We just don't know about them. But it's not just extreme risk. There's high-risk people and intermediate-risk people, and even some low-risk people that have told their docs, I just don't want to see anybody. But as less invasive therapy than my surgery comes available, they're going to show up. And there's a lot of people that are asymptomatic in the elderly. At least you think they're asymptomatic because they tell you nothing's wrong because they really aren't doing much, and they just don't want anybody to know. But the conclusion of this was that a lot of these people really are symptomatic if you look at them, and they really do meet all the guidelines for having their valve repaired. And if you don't treat these people, the event rate is extremely high. So aortic stenosis really is underdiagnosed. TAVR is likely to markedly increase with time, and I think surgery will moderately decrease. It's not going to go away, but it'll decrease to a certain amount. Is there a problem with undertreatment of aortic stenosis with TAVR? That's a resounding yes. Thank you very much.